Hello, hi guys, welcome to the Two Docs Podcast. I'm Dr. Ellie here.
And I'm Dr. Ingky, and welcome to the podcast whereby two medical doctors generally speak on things which are non-medical. However, for this month itself, it is a little bit special.
Actually, last month was also quite special.
Last month was special, this month is special, so every month is special.
Every month is special for you guys. Coming up for Christmas. Anyway, it's November. November, we were talking about Sexual Health Awareness Month. And last week, we were talking about how to prevent sexual violence.
Yes, correct.
So this week, we have ourselves a really special guest who's going to be covering 2 episodes with us.
Yes, that's right.
And it's in a topic that I think does not have enough exposure.
Yes, I would say a lot of people, when it comes to his particular expertise, we tend to shy away, or we tend to, keep things under wraps.
Correct. We just Google and we think we know everything.
Or we just try to ignore a lot of times.
Most of the time we ignore. Or we just do what we typically would say won't happen to me.
Yes, exactly.
Won't happen to me. So therefore, I don't need to know. As long as I don't know, it didn't happen.
Correct.
Anyway, we won't talk too much. We're going to bring him on. He's going to introduce himself. Then we will tell you what is today's topic. In fact, we will let him tell us what is today's topic. And with that, we would like to introduce and welcome Dr. Anaand.
Hello, everybody. I am Dr. Anaand, and I am running a clinic where we actually specialize in sexual health, HIV medicine.
Wow.
So we focus primarily on sexual health alone. No GP, nothing else, actually. So that's what we do. So we need to the whole idea is to bring light into this topic that is something that's unspoken, actually. So we want to speak about the unspoken. Simple as that.
Interesting.
Great. And today, what will we be talking about?
Today we want to cover about sexual health in general, overview, what is sexual health, what it consists of, and what are the common STIs that we encounter, symptomatic, asymptomatic, both. And the screening, how we test, what sort of testing that is actually primarily done, and simple preventive measures. Right. Not going into medication, just preventive measures in a whole.
Okay,
Good.
To summarize, today, sexual health, types of STI, STD,
STDs,
screening, and simple preventive measures.
Yes. Yep. All right, so let's start off with the definition, or what is sexual health?
Sexual health, we need to look into a whole bigger picture. So it defines in a state of where we need to take it into account physical, mental, emotional, and social well-being, with the relation of sexuality, with the absence of dysfunction or disease. Okay. So that's how we see sexual health. We need to take into 4 different concepts, actually.
And you finish it in just one breath.
Yes. So that is sexual health.
But it's so complex.
It is actually very complex.
It's very complex because it can cause a lot of, if something happens to you, of course it can cause emotional trauma, mental trauma. So you need to take into a whole picture, actually.
All right. So tell us a little bit, shed a little bit of light on what is the overall awareness of the general population regarding sexual health in Malaysia.
In Malaysia, I have to say it's actually really poor because it starts from the beginning. Upbringing is one. So one is start with from the school. Sexual education in school is just not up to par in Malaysia itself. It's just one page literally. Even in school, teachers used to skip the pages because they're even shy to speak about it. That is just explaining the anatomical pictures, male and female. That's it. Not diving deep yet. So if we skip that part, how are the kids even going to know at that age? That is the age where they tend to experiment. That is the age where they want to try new things. What if I do this? What if I do that? If you're not exposed in that age, what is going to happen then? So I would say in general, to sum it up, it's actually really, really poor. So we as doctors in this field, even in infectious disease side in general, really have to push ourselves to educate people, tell them to read more and have seminars, have talks to tell them, okay, this is okay to actually speak about this. It's not a stigma. You need to know about your own health. If you don't know about it, your own self, how about everybody else? How about your partner, for instance, right? So I would say it's a work in progress, but it needs a lot more work. Yep.
Agreed.
All right. So in your point of view, right, where does sexual health awareness or education, where should it start? Should it start at home? Should it start in school? Or should it start at the workplace? Or just conversation among friends?
I think everything has to come into play. First, at home, parents should play a role. The moment they realize the kids are hitting teenage age, they should openly speak about it. For example, if you're watching TV, let's say some scenes starts popping up in the TV, right? Instead of closing their eyes, instead of fast forward. You want to quick, okay, where's the remote? You want to fast forward it, and you should just, let them see. This is, if they don't see that, they might want to, okay, I'm going to go to the room, I'm going to switch on my computer, I'm going to serve on something else, and going to find something else, So that starts at home itself. The next is school, of course. Sex education is crucial. Outside of this country, people actually bring in fruits and whatnot, show the kids how to actually put the condom on, how you actually use it, how you lubricate. All these things is very important, actually. That is the age to actually learn. Not when you hit your 30s and you're still like completely, out of the town, you have no idea what's going on, and also in workplaces where harassment and all these things tend to happen because especially people with like this, they didn't grow up well. Upbringing plays a key role here, So they tend to like, okay, what if I do this to this girl? What if I say something like that? So like, is it going to be harmful? Is it going to be harassing? Because he doesn't know how the feedback is going to be. So a lot of things, I would say everything has to take into account.
When it comes to these sexual health topics, right? What are the common misconceptions that Malaysians have regarding sexual health?
The most prime misconception is to think that, if I don't have any symptoms, I don't have to get myself tested. That's the most common thing. Like, yeah, but I'm fine. I don't have any symptoms. Why should I go and get myself tested? She has symptoms. She should get tested. What is wrong with me? I'm not wrong. Being judgy in that way, that's also stigmatizing, actually. A lot of infections are completely asymptomatic, especially chlamydia, for instance. 50 to 60% of guys have no symptoms whatsoever, and they become asymptomatic carriers and go around passing around to everybody. And for girls, up to 70%, they have no symptoms. So equally, they can be asymptomatic carriers, especially how you practice your sexual life plays a key role here. If you're polyamorous, you have multiple partners, you have to be extra careful in this sense. Everybody can get it, It's like giving MCs to everybody, you go around giving chlamydia. So it's really bad, So in that sense, yeah. So this is the major misconception, actually. Thinking that I'm fine, I don't need to get tested. Given the fact that you did have an exposure, you do practice unsafe sex, more the reason to get tested regardless.
Now, correct me if I'm wrong. Like people who had, let's say, the first sexual contact, they tend to think maybe that it didn't happen to me, won't happen to me, just because it's my first time, maybe my partner's first time, and therefore they rarely get themselves tested right after. Is that something that occurs? Or?
It occurs all the time. They always feel, this is the first time. What is the risk like? First time or second time, especially with somebody that you have no idea what the sexual history is, they're not going to throw their profile of sexual testing on the table and say, look at my profile, I've done all these things and I'm clean, now we can have sex. Nobody's going to do that, So you just have to believe that no matter what, you have to trust yourself first. And then you trust the person next to you, End of the day, if you sleep with someone, you're also sleeping with the person's past, Whatever the person has done a couple of years ago, a couple of months ago, a few days ago, you gotta understand that fact,
Okay.
Okay. Right. So off camera, you mentioned something. You mentioned that there is actually a difference between STIs and STDs, sexually transmitted infections and sexually transmitted diseases.
Yes.
So what is the differences between both?
It differentiates in one word: symptoms. STI means infection. It's just infection beginning to happen to you, but no symptoms whatsoever. So disease is actually a stepping stone from infection. So it progresses into disease, actually. So people tend to call STD without realizing if they have no symptoms, it's actually identified as STI. But we usually use STI until it's proven otherwise. So evidently we have proof after testing saying that, okay, you have this and all that. Then we can say, okay, it's actually an STD right now. Instead of having a primary diagnosis, then obviously it's an STI. Okay. So that's how we identify. It's just purely by symptoms.
So only when you manifest some kind of body symptoms.
Yes.
It's called
disease.
The STDs.
I'm guilty. I just call them all STDs.
Same as well. Even as a doctor, I just say no. For me, I always thought it is one and the same. I always thought STIs and STDs are just
because they always put STI/STD.
STDs, exactly. I always thought it's one and the same.
Technically, they shouldn't slash it. It's two different things, actually.
Yeah, you should put STI and STD. Just get yourself tested for both.
Of course.
Okay. What would be the one that you would say? Let's say STI, no symptoms. What are the ones that should get themselves tested, or what kind of infections which are under tested?
In Malaysia, usually if you go to any clinics, general clinics, they would say, let's do a complete screening for you, comprehensive screening. They call it such strong words, but still, they only do blood testings. Blood testing sensitivity is very, very low. There's only so much that they can pick from blood sensitivities,
And the common ones are just VDRL.
Yeah. Even
chlamydia, gonorrhea.
No, they don't even do that.
They don't even do that.
A standard test
it's just VDRL, HIV.
VDRL,
HIV.
That's it. And then if you're...
Even hepatitis will be missing, actually, sometimes.
So let's add in hepatitis. 3, and if the fella is a bit smarter, then you say, okay, let's do a HSV, herpes simplex.
Yeah.
That's it, right? That's it, right?
Yeah.
So all the others, which, as you said, like chlamydia, gonorrhea, you might be walking around with no symptoms.
Yeah.
Correct.
These are all not tested.
Yep. You can be walking around with 20 different STIs with no symptoms.
Directly.
Yeah.
Wait, take the whole Malaysian thing. It didn't happen.
Well, we don't have your sexual history here unless you throw test. Okay, so what are the, I would say, I want to ask you, what are the top 5 most common STIs or STDs in Malaysia?
Most common, I would say, chlamydia, gonorrhea, syphilis, and herpes. And sometimes you can also have a combination of mycoplasma, ureaplasma. This is new, but it's been around for ages, but new to Malaysia, obviously, because people don't really routinely test for these things, So this is the thing. It's very, very common, and they're known to be completely asymptomatic for years and years and years. So if you don't test, you never really know. That's the thing, So even when going back to when Dr. Ali mentioned about HSV testing has been removed from CDC or infectious disease guideline as for testing because it is antibody. Why do we want to test for IgGs when it's completely pointless? We don't treat IgGs, so we don't even, but it's still done technically. Even the labs are doing it. Why? What is the purpose? It's completely redundant actually, and it's also very expensive.
Yeah, it is.
So it's not justified. So a lot of clinics are doing it for the sake of just doing it. It comes in this package and whatnot. So they just do it actually. Because patients should understand what am I looking for? What am I doing? What am I doing actually? What am I actually testing for? How comprehensive is comprehensive? That is basically superficial. That's like on the surface area actually. We don't even do that things anymore by infectious disease guideline actually.
All right. Okay. So let's touch back on the first disease which you mentioned. I think you mentioned gonorrhea. Oh,
Yeah.
Okay. Let's talk about chlamydia first. So what are the general symptoms of chlamydia?
Sometimes it can be like what I mentioned, 50 to 60% is asymptomatic. So when it starts giving symptoms, usually it starts having dysuria, painful urination tends to happen. Incubation time is within a week. But sometimes within 3 days, you can start having symptoms already. It depends, So usually they will start having painful urination. Then it starts forming discharge. It's like clear, like pre-seminal fluid kind of discharge, actually. And then the swelling tends to happen. If it's a guy, then it starts having testicular pain. Then it starts having swelling over the bilateral testicles. And then for girls, they start having swelling over the vulva or the labia. It becomes really inflamed. Irritation starts happening, So those are the common symptoms, disturbing symptoms, I call it. Then you realize, okay, something is going on right away. Then they start scratching, then rashes starts forming, So all these things are disturbing. So then they'll know, okay, I need to go and see the doctor right away. If there's no symptoms, obviously they'll be like, oh, I'm fine, without knowing that actually they have chlamydia in them, But gonorrhea, in other way, it starts forming symptoms right away, like really bad white to yellow to greenish discharge, foul smelling. Yeah, it stains, it involuntarily comes out, so it starts staining your underpants. Then okay, it's really bothersome.
If there was a smell that you're going to describe for gonorrhea, what's the smell?
It smells like rotten eggs left there, it's really disturbing actually.
So guys, girls, if you've got
rotten eggs
smell coming out from your private area,
you should go get self-tested.
Yeah,
right.
Get yourself tested.
And
it's not soiled underwear.
And I think one of the misconceptions is not only should you get yourself tested, you should always get your partners tested.
Absolutely. My gosh,
your partners
exactly.
/ partners.
Yes, partners.
As many
Correct.
as you know.
So how long do you have to go back to get your partners tested? Is it like a 1 month partner or 2 months? Or?
It's very difficult. If this person is really sexually active, been sleeping around with the entire Kuala Lumpur, then it's going to then it's a problem. It's a problem. How are you going to do your tracing all the way?
Okay. Austin Powers. Okay. All right. I understand.
Okay, all right. So we've covered chlamydia, we've covered gonorrhea, syphilis.
Yes.
Yeah, syphilis is also a tricky situation because sometimes people always mistake. Syphilis can form in either your oral cavity sometimes, or your genital area, or in the anal area, or vagina or penis. This is a common location.
Right.
So sometimes some people, because the primary syphilis forms within like 4 weeks of post-incubation time, 21 days and beyond, right? So sometimes when it happens in the oral cavity, it forms like painless ulcers, which mimics after ulcer that forms in usually the common ulcer. Exactly.
There's no difference between that and a chancre.
When you see it clearly, you can actually tell the difference. It's a little bit more hollow. It has a demarcation and all those things actually.
Larger, smaller?
Larger, it's a bit deeper, and the color is a little bit different. Okay. So for a layman, they might just think, oh, it's just, I didn't drink enough water.
One more. if someone has stress ulcer, usually it's one, and sometimes two, rarely a lot. If
Yeah.
they've got more than two, would you say that there's a slight higher chance that it could
I would still get them tested just to be sure we're not looking at something else. You know, it's always a possibility sometimes. It can be a reactivation of the syphilis itself. Maybe they have been treated before, now it's reactivating again. There's always a possibility, just to be sure. You know, so usually the thing they always miss out is thinking that the syphilis primary ulcer is actually an aphthous ulcer. You know, so we have to see to actually do the test to believe that it's actually primary. But sometimes when you see, you know right away, this is primary syphilis. You need to take your penicillin shots. You know, so then it forms. And then subsequently it progresses into secondary syphilis where you have like rashes all over your body, full blown everywhere. And the rashes completely, you don't feel the itch, you don't feel the pain, nothing actually.
just rash?
Just flat, diffuse rashes.
Difference between that and chickenpox?
Very different. Chickenpox forms pustules, painful ones.
That and measles.
Yeah, measles come from herpes family as well. It's Zoster subtype, right? So it's very similar presentation, has herpes as well. This, but shingles is actually a little bit more
shingles
forms
are
on your
different.
torso. Yes, of course.
That's different.
Yeah, HSV is either oral face and down the genital area. Yeah, the distribution is entirely different. Syphilis and herpes actually.
Okay, so coming back with syphilis, so would you say if someone has recurrent, quite a lot of ulcers,
Yes,
get yourself tested?
definitely.
Just because
definitely.
if you have ulcers on the oral cavity, are other areas infectious?
No, it doesn't really move around like
So
that.
where it is, where
Yes,
it
that is
forms, that's
when.
where it
Yeah.
happens.
So that is the transmissional route.
Okay.
You know, so when this person has ulcers in the tongue or inside the organ, the gums and whatnot, and they start making out or kissing the partner, that is how you transmit. Because the fluid moves around, moves to another person. And that person can get it easily, actually.
And is it only mucosal area? That means here, genitals. What if they start kissing on the neck and all?
No,
right?
absolutely not.
Okay. Just to be clear.
Just, yeah.
Don't give me that look.
No, he's asking for himself. Anyway.
I
Right. So
I don't get a lot of people who ask questions.
That's good. That's good.
okay.
That's good.
I'm
That's good. That's good. So you did mention there's one more disease which is rarely tested, and
Yes.
that is
Mycoplasma genitalium
yes.
and ureaplasma urolithicum. This is it comes from mycoplasma. They even have few other subtypes actually when you break it down like a tree. You know? But this is the things that we don't really test because one is not so common. But it also belongs in the family of STIs actually. You know, we need to check because when you do a STI profile, there's 7 things that you need to investigate: chlamydia, gonorrhea, mycoplasma, and ureaplasma, and 2 different subtypes from that: Mycoplasma hominis, Mycoplasma genitalium, Ureaplasma urolithicum, Ureaplasma parvum. So those are 4 by itself. So they all are form of STIs, but these 2 groups usually have no symptoms whatsoever. What they can sometimes cause is dysuria. That's it. So that can be anything, right? People might just assume, especially girls, just UTI, it's just the time of the month, you know. But you need to get tested sometimes because these are known to be also resistant to certain type of antibiotics. You can't just put them on doxycycline or azithromycin; they won't respond sometimes. You need to give them moxifloxacin, which is very strong and very expensive. So you really need to know what are we looking at here. Sometimes simple symptoms can also be something a little bit more major at the end of the day. You know.
This testing, what would be the ballpark figure for this? Because people obviously want a ballpark figure. How much would it cost? And how often should they get themselves tested?
Yeah. Testing for this sort of organisms, we use PCR method, polymerase chain reaction. Yes, it's also very expensive, easily 350 to 400 ringgit per location analysis.
Per disease.
no per location.
Per
location.
location for 7 investigation. Why I say location? Because it doesn't mean that you do one analysis, you're clear of infection. It's not like that. Infections sometimes are localized. They will just stay in one location, you know. So we need to do a throat swab for PCR 7 infection. We need to do a penile swab or vagina swab for 7 infection. We need to do a rectal swab for 7 infection. So 3 locations has to be analyzed. Then we pick out. Sometimes your throat will be positive, everything else will be negative. You know, because it's localized, right? So that's why we need to investigate all 3 locations. Some people do one and say like, I just tested for everything and I'm clear. No, it's not like that. What if you have an ulcer inside? Nobody tested before.
Understood. Now next is the very painful question. So throat, we know you just shove it down the throat. Vagina, just vagina. How does the penile work?
We also need to
shove it down the
shove it
shove it
down.
down penis. Yes, shove it down penis.
The swab has like an indicator. So it has to go all the way as deep as possible in the penis. Yes, it's excruciating. So sometimes for asymptomatic screening, we can also do urine analysis. If you don't want to shove it down, cause trauma, can also take urine
So
analysis.
urine would work.
Yep.
What's the sensitivity difference?
Its sensitivity is almost the same actually.
Okay, so guys, you don't need to get
Something
something
shoved down.
shoved down that hole. Call your penis. You can just pee it out.
Yep.
You can just pee it out. Is it more expensive?
Yeah, it's the same thing, same price actually.
Okay.
Pee it out, man.
All right, because as we know, if you ask most guys to shove a stick down the penis, they will say no.
No one's gonna shove something
thanks,
down
no
and
thanks.
just say it didn't happen to me. It won't happen to me. All right, moving on to the big ones, STD testing. What would be the common ones that people should be doing apart from just HIV and what is it?
HIV, and
Syphilis.
syphilis,
Yeah.
and hepatitis these days.
That's it.
People should actually, but okay, why they usually do syphilis, HIV? Because all those are done in blood testing. It's very common to do, very easy to do, cheap, cost efficient. So when we speak about other STIs, yes, one thing is also a little bit expensive, and we need to do 3 separate locations. It's going to be 350 all together, you know. So it is going to be expensive, but it all depends on how you practice your sexual life as well. So how often you need to test is how sexually active you are. By guidelines, it's only recommended to do once a year. But nobody does that. Nobody's but
that's right.
in the right mind, right? So usually I tell the patients to at least biannually, or sometimes 3 monthly, or some cases every month. So it depends on how active you are. If you keep coming back over and over with recurring infection, then we have to do something about it. So every month is because once you do a testing, something is positive, you get treated, you have to repeat the analysis again just to be sure the infection is cleared out. It's not like a one-time thing. You just do a testing, get treated, and go. No. What if the bug is resistant? It's still there. Yes, you have no symptoms. What if it's still there? You're still a carrier. You're still going to give it around to other people. So this is what people need to understand. The importance of getting testing. Always know your status. It's very important, actually.
Not just yours, but your partner too.
Absolutely.
Because you could be with the same partner,
Yeah.
but your partner could be
With everybody
Yeah.
else around
Yeah,
Kuala
a lot of
Lumpur.
people, yeah.
But whether your partner will tell you or not, it's a different thing.
Yeah, exactly.
That's the thing. Communication is key. If
So
they
we'll
don't,
come to that later.
absolutely,
right?
yeah.
All right. Just to wrap up on screening. So you were saying blood test typically is the one that most of us do.
Yes.
Yet it's not very sensitive.
No.
Could you cite some examples of certain disease or some certain STDs or certain STIs whereby blood test is totally not helpful or too late, and what are the other options that they have?
Not helpful in the sense for herpes, for example.
Okay.
No point doing blood testing for herpes. No point doing blood testing for any form of bacterial infections like chlamydia, gonorrhea, and all these things, because I've seen people doing IgG analysis for chlamydia. What are we looking at here, and what are we going to treat? It's pointless, actually. So this sort of testing that we should, because they also do antibody testing for all sort of diseases, bacteria especially, or HSV, or even for, I've seen something else actually, for other infections, even for viral infections. There's no need to do such things, actually. So we should avoid, because it's not even in our practice, it's not even in the guidelines. So labs should also remove these testings for good, because it's pointless. We are doing it for the sake of doing it, but we're not even getting treated for.
So for the sake of our viewers who might not always be doctors, so what you're saying is if we're doing IgG testing,
Yeah,
it's pointless.
It's pointless. Immunoglobulin G that forms at least 21 days upon infection, completely pointless, actually.
Pointless because it's not going to guide us there, or it just tells
it
you
just doesn't
a
pick
past
up
infection
any-
and then
It just tells exactly. It
Any
just
past
tells you a
infections.
past infection. It gives you a number there. This sort of numbers amount is there, so that's fine. It shows that you've been infected before, and your body has produced the antibodies towards the infection. That's it. That's the story. The story ends there.
Okay. So it does not tell really what's your status. Right?
No,
Okay, so what should they be testing then?
they should be doing PCR testing.
PCR testing.
With the blood testing, obviously we need to do blood testing for certain infections like hepatitis serology. You want to see whether you're immune or not. For HIV and syphilis, if you tested positive for syphilis, you want to see the titer, how high, how low, whatever it is. And also for other infections like whatever we discussed earlier, chlamydia, gonorrhea, mycoplasma, ureaplasma, all these things has to be done via PCR alone. That is the gold standard testing. Whether we do.
So when we say PCR, we are testing for that specific bacteria or virus. How much quantity?
Quantity we can't identify in the PCR test alone. That
Okay.
is individual testing.
All right.
But we don't practice doing qualitative testing as well.
Okay.
We only identify
It's there, not
is
there.
there, is
Whether
there,
there
whether
is
it's there
or
or
it's
not.
not there.
Because we don't do qualitative. That is
Okay.
very expensive,
Alright.
and we don't practice in Malaysia.
So it's kind of saying like, so if HIV fits into this hole,
Yes.
so we just take it, put into this PCR, and if it goes in, You've got it.
Yes, but for HIV, it's a different story. HIV or hepatitis viral infections, we need to run viral load studies to see how high or how low is the viral load, how many copies, how many replication can be found in one drop of blood. So that will tell us a treatment plan for this patient. So HIV is positive, antibodies comes up positive, the rapid test or the antibody from your lab test comes up positive. So we need to send for HIV viral load to see how high the viral load is, the baseline viral load, how many copies, is it 100,000, 200,000, 300,000. So we need to start medication right away. So then we consecutively we need to repeat the analysis. The viral load has to be repeated every 3-monthly basis until the patient hits suppressive level, less than 20 copies flat. So we know that the medication has done the job.
So
and
they're
then
not so infectious, even though the virus is still in the body.
yeah, completely non-infectious. We call it U equals to U, untransmittable equals to undetectable.
That's not C means not there.
No.
Okay, how soon should someone get themselves tested after exposure?
How soon? Well,
Using PCR
using PCR
versus using blood.
within a week.
Within a week for
Yes.
PCR.
Yes.
So it's that sensitive.
Very sensitive. Sensitivity is 98 to 99%.
Okay, but within a week is within 7 days. What is the quickest? Because if you go like, let's say, had intercourse now, and then it's let's say 6 p.m. now.
Okay.
Do they go what? 1 hour later, 2 hours later?
No, of
the
course
next
not.
day?
At least I would say give it 3 to 5 days.
All right.
The quickest time that I can actually give.
3 to 5 days.
Yes.
Then go get yourself tested.
Yes, absolutely.
Okay. So
Yeah.
in case if you had a night that you forgot,
Yeah.
it's not even a night to remember.
Night
Just
to
no. I mean, I would say just in case you are worried.
Yeah.
All right, you are worried you're accidentally exposed to certain bacteria or
Or
viruses.
if you don't trust your partner.
or you don't trust your partner, or you have this big, looming worry in your head. Roughly 3 to 5 days after exposure or after a potential exposure, get yourself tested.
Yeah.
Yeah.
Yeah. Okay. And the sensitivity you say is about,
Is very, very high.
98%.
Yeah.
Okay. All right. Where else? If it's blood, once the window
Lesser
period
lah.
is 4-5 months.
It depends. HIV is from 30 to 90 days.
Oh, so you really
Yeah,
don't know.
it's very difficult to check actually.
it's
Blood,
difficult to
it's
say.
very even syphilis is very difficult to check. Even if after 4 weeks, then you can actually detect the RPR after that. So initial stage we still use PCR. If we suspect any ulcer, we need to do a swab test. Then we can detect the origin of syphilis, which is treponema, which causes syphilis. So we need to do such things. You can't just wait. We can actually wait it out. Do your RPR in 1 month later. By the time he has full blown rashes all over.
Okay.
Yeah, so that is actually delaying the treatment plan.
So I think one very important take-home message, guys, for our listeners out there is that if you had any form of exposure and you want to get yourself tested, get it tested 3 to 5 days after the exposure. Get it tested soon, and you need to do a PCR test. Because if you do a blood test,
It might not be as accurate.
you might have a false negative.
Exactly.
Meaning to say,
Yeah.
it came back negative. You're happy. You went on to continue with your lifestyle, and you could have infected other people because it has not shown.
Yeah, still in the incubation period of time, so it's not manifested yet. So and then it goes around.
Okay. So during this incubation period, since it's not detected, are they infectious?
Not really though.
Yes or no?
No.
No, right?
No.
Okay. But it's also if at this point of time, if they start treatment, it's the best prognosis
Yes, of course.
before it becomes fully
Yes.
right? Okay. Let's move on to final bit for today's segment, which would be preventive measures. You were saying there were two C's:
2 C's: condom and communication.
condom and communication.
Well, that's the only way you can prevent from getting yourself any form of STIs. Yes, it's about 95%, 5% chances for it to rip, tear, explode. It's always there, But at least 95% is a huge stake there. Go on and take the risk, Why do you want to risk by not using a condom and risking yourself and also risking your partner, especially when you're living a very sexually active lifestyle? So then second C is communication, of course. Always talk to your partner, especially when you're getting into a new relationship. Go to the clinic, get tested together. At least you know that you have a proper testing profile for you and your partner itself. And it gives you a ease of mind, and takes the burden off your shoulder, like, okay, he's clean, I'm clean. There's nothing to be worried about, Instead of thinking, what if he has this, what if he has that, I don't know who the hell he slept with and whatnot, So it gives you an assurance, actually. So this is what I always tell my patients. If you want to go into a relationship, serious one, monogamous one, so please get tested together. At least you know where you stand in your sexual health. It's very important, actually.
Okay, and it's better to get tested in one of these more specialized clinics.
Of course, yeah.
You know more, and plus they value anonymity much better.
Yes, of course.
As opposed to a standard GP, which can be done, but may or may not have certain stigma. Does patients face that kind of?
Yes, I have a lot of patients coming in telling they went to multiple different clinics where they've been shunned away by the doctors themselves.
The doctors themselves shun away.
Because they tell the truth. They want to express themselves. That okay, I have sex with another guy and things like that. But immediately the doctors feel uncomfortable. So we have to go back where the stage where you all took an oath at one point. No judgment whatsoever.
Yep.
Treat the patient as whoever it is, whatever walk of life the patient comes from, right? So they are just, going against the oath, to be honest. So, and then they tell me the story. So why judge them for wherever they are, So yeah,
Okay,
so stigma is still there.
Final fun fact question. Condoms. Are there a difference in disease prevention of the thickness?
I think thickness do play a role here because that 5% of chance is actually pretty high. Because I've seen so many big cases where the condom is actually ripped, torn, and whatever. Maybe the technique is wrong.
Okay.
No proper lubrication, wrong sizing. So all this thing has to be seen as well.
There's a size?
Of course.
Oh, really?
Yeah.
I always thought it was standardized.
Yes, I got it!
Standardized size.
Absolutely not. No. Have you heard
Really?
about?
There's sizes there. There's SML.
Yes.
Why are you blushing?
Because for what I know, I was always shopping at the L size.
That's why it's so loose. All right. I think we had a lot of fun in this round. Thanks, Dr. Anaand, for this very, very enlightening episode whereby we are talking about sexual health,
Yes.
STI, STD,
STDs,
screenings, prevention,
yeah. Yep.
and the importance of screening, especially that. I think we can go on for an hour
Yeah.
with this
Yeah,
topic.
yeah,
definitely.
yeah.
However, this is a prelude to a lot of many other topics that you can search, or you can actually Google Dr. Anaand. We'll probably leave the link somewhere down there.
Yep.
And you can even drop him a line if
Yeah.
you want to ask further details. Because if you ask us, we're also going to ask you.
Yeah, I'm going to ask you. I'm going to Google. I'm going to ask you.
Episode, right? Obviously, both of us are
I
quite.
have no idea. I'm clueless.
Not just clueless.
I'm
lah.
clueless.
Yeah, I just pretend I
I'm
know a bit
clueless.
more here. So
I'm
so
clueless.
better ask the expert all about that, especially the sizing thing.
Yes.
Sure.
So, next
Next
session.
episode, next session.
The next one, we're actually going to be speaking on something a little bit more stigmatizing.
Yes.
Yeah, living
with HIV.
HIV.
So I think this is a very exciting episode, and I encourage you guys to tune in next week, whereby we know people out there have HIV, but you don't know. We have never even been in their shoes, much less walk one day in their shoes. And what is it like living with HIV, and how can you lead a seemingly normal life?
Yes, exactly.
Right, so stay tuned, guys, next week. In the meantime, hit the like button, subscribe us, and leave any comments.
Leave any
or
comments below.
questions to Dr. Anaand,
Yes.
and he'll get back to you on that. Yeah, we'll let him do some work this
Yeah.
time. So until then, we'll see you guys next week on The Two Docs. I'm Dr. Ellie here.
And I'm Dr. Ingky. Have a
that's
good
Dr.
weekend.
Anaand.
Yeah, and Dr. Anaand as well.
See you guys.
See you guys.